Good evening, everybody. Thank you for joining in. I appreciate it. Hello, Tori. Good to see you. Hello, anybody else that is watching this live or is coming into this and watching it at a later date. I appreciate the views at a later date as well. So last night I broadcast for the first time in a while. I figured I'd do it again tonight. Um, I just kind of wanted to talk about um, nurse and provider burnout, and by provider I mean like doctors and any anybody else that is had to deal with COVID and the multiple waves that we've had, as we're now um, riding the fourth wave of COVID at the moment, which is the largest and biggest wave that we've seen so far, unfortunately. Um, a lot of people have, a lot of nurses, a lot of doctors have gotten to the point where they are at a breaking point, or they are at a point where they don't feel the same level of compassion for people as they once did. I can tell you from experience, I feel that myself too. Um, we've had a lot of nurses leave the profession. We've had a lot of nurses leave um, to go do other things, to get away from COVID, to move into other areas of nursing where they won't be as affected by COVID, which has put a strain on those of us that have remained, those of us still in the ICUs, still in the ERs, still manning the med surge and step down units where all these patients are going. Um, it's created quite a strain on the hospital systems. It's created quite a strain on the doctors. Um, I actually know of some doctors that have left practicing within the hospital, not necessarily left practicing medicine, but have left the hospital because of COVID, because of how taxing it is and how um, much it's weighed on them over the past year and a half now. Because we are now, I mean, we're a year and a half into this, and we're no better now than when we started off. We're actually at this point in a much worse state because of the number of cases that we have, especially in places like Florida, where I'm at. Um, the cases continue to go up. We've had, in the past 2 weeks, we keep breaking records. One day it's 35,000, which was a new record. Another day it's 40,000, and it's 53,000 cases in a single day of people being diagnosed with COVID-19. And most of the people that are being diagnosed with the variant strains. The Delta strain specifically is the most dominant strain in the US and pretty much throughout the world at the moment. Um, and it is tougher on people. It is more resistance to some of our earlier treatment options that we had, as far as like people receiving blood plasma from donors that had already been through COVID. They're finding that the convalescent plasma does not work for people that have had, or people they're getting the new variants of COVID. The convalescent plasma doesn't seem to help them. It doesn't seem to provide any more immunity, or more, not, don't say immunity, but more, it does not seem to provide any more boost to the immune system like it originally was, or the previous variants. So I know specifically at my hospital, we're not even giving convalescent plasma anymore. We do have one of our doctors, very, very trusted doctor. I respect him quite a bit. We kind of look at him as our guru on COVID. He's kind of the specialist, and he's kind of become the specialist for us at the hospital. So typically, when we have any questions, we go to him. we ask him, "Hey, uh, doctor, what do you think about this, or what do you think about that?" And he will give you his honest opinion. He's very well read, very well researched. He keeps up with all the latest medications. He's actually within our hospital conducted some trials of some medications that um, had some promising outcomes, but are not still not being widely accepted or widely used yet, because they're still being investigated in other facilities and other hospitals and other countries for their efficacy, to find out how well they actually do fight against COVID. But I can tell you, just on the small unit I work on, which is a small ICU, typically we have 12 beds. We have the ability to expand up to 24, but we've never had the staff for that. The other 12 beds are typically like our step down unit. They're manned by nurses that are not IC nurses. They are trained to work in step down or progressive care. So having the staff available to man 24 beds just has never been available on my unit. Uh, and what I've seen in the past year is just a mass exodus of people, either people retiring early or people just moving on to something else. And the ICU itself typically has a turnover, a specific turnover of a specific turnover of a select group of people that get into ICU specifically for their schooling, specifically to move on to do things like become a nurse practitioner. If they want to work in acute care in a hospital setting, they typically have to have some type of ICU experience. So there are some of those nurses that do that, but not all the people that have left because they have finished their nurse practitioner degree and passed their exams to become a nurse practitioner. People have just left because they are um, burned out at this point. They are tired. They are to a point where they don't want to be there anymore, and that's a sad state to be in. And I've found myself on certain days feeling the same way, feeling that I don't want to go into work. I don't want to go uh, work in an ICU and have to go into COVID room after COVID room after COVID room after COVID room, um, and risk exposing myself and my family to this, because people are still not going out over 8 months after we've had the vaccine available and not getting vaccinated. Um, it's not to say that you can't get COVID with the vaccine. We do see that, but it's just like getting the flu with the flu vaccine. Those people typically fare very well. They typically don't end up in the ICU, and the few that do, the small majority of the people that do end up in the ICU with COVID seem to fare okay, seem to kick through this, and with the treatments that we're able to give them and the medications that we do have available to us at the time, they are able to recover meaningfully, and recover quicker, much quicker than somebody that does not have the vaccine. That may recover as well, but one of the problems that we're seeing, and many doctors will tell you this, especially pulmonologists, they're seeing the long-term effects of COVID already, from people that have survived this from 6, 7 months ago, 8 months ago, a year ago. They're coming back into the hospital, or they're coming back into the doctor's office with just extreme fatigue, shortness of breath. Some people are requiring home oxygen, to where they can't be without a certain level of oxygen for any given amount of time. Um, and those are typically things that we see in older people that have been smokers their entire life, where they have emphysema, or they have uh, COPD or something like that, where they require a liter or two or three or four of oxygen on any given day just to keep their oxygen saturation up. But we're seeing this from people that are non-smokers, people that are just getting COVID, people that are um, younger now, because that's the demographic of people that we're seeing coming into the hospital. It's not your 70, 80, 90-year-old people that are coming in with COVID. It's your 20, 30, 40 something year old people, 50-year-old something people that are coming in with COVID. And the ones that are unvaccinated are doing poor. They are. This disease is no joke. No matter what your Facebook buddy tells you about how I had it and it wasn't a big deal, it was just like the flu. For some people, that's true. For some people, that is true. For some people, it will just be like a flu. But for a large number of people, it is not just a flu. It is more than a flu. It is a life altering disease process that is not going to leave them um, anytime soon, unfortunately. They're going to live with the ramifications of having had COVID for the rest of their lives. The permanent lung damage, the permanent brain damage, the permanent heart damage, kidney damage, all these different things that are associated with COVID that we're finding out months and months and months later after COVID has been around now for over a year. All of these studies are coming out showing the long-term effects of what COVID does do to people that do survive it. And it's not a pretty picture. It really isn't. So the chances are that, yeah, you probably could get COVID and you might fare well, even without having a vaccine. But why take that chance? Why not just go out and get vaccinated? Why not just protect yourself? Wear a mask in public. Wear a mask when you're around people. Um, Wear a mask when you're in the store. Even if it's not mandated. It's not mandated in the county that I live in right now or the surrounding counties. I don't go anywhere without a mask. I haven't basically since they started doing mask mandates over a year ago at this point. Yeah, I mean it's an inconvenience. It's an inconvenience. It's not comfortable to wear a mask all the time, but it's also not comfortable to have a tube shoved down your throat when you have COVID and you're sitting in an ICU and you're gasping for breath. Um, so I think a mask is a much better option than the provider having to come in and emergently intubate you in a crisis scenario where you can't breathe and we can't get your oxygen saturation up above 70%. And that's that's our last ditch effort. And sometimes we just hope it works. And sometimes it doesn't. Um, I've seen many, many people come into the hospital unvaccinated that we tell them, hey, these are the steps you need to take. This is what you need to do to help yourself get better while you're here. And people don't want to do it. People think that we're still full of shit at this point. They are like, oh, I'm fine. I don't need that. I don't have to do that. Or, oh, it's too uncomfortable. I don't want to lay on my belly to sleep. Where we've many documents, many studies have shown that proning, laying on your stomach to sleep when you have COVID, is one of the best things that you can do. Honestly, even if you're at home with COVID and you don't have a severe case, that's still one of the best things you can do at night is to sleep laying on your stomach. Some people don't like laying on their stomach, but anatomically, it helps your lungs expand. It helps you breathe better. Um, and that's where these things come in. And having patient after patient after patient that just refuses to do these things. And we tell them, these are the next steps. This is what's going to happen if you don't do it. And they still refuse. Or maybe they'll do it for one night and then they think, oh, I did it for a night, I'm fine. It's not how it works. Um, I've seen too many patients go down that road where we tell them, hey, you need to prone, you need to lay on your stomach when you're sleeping at night. Even during the day, you need to lay on your stomach after meals and whenever you can. It helps to increase your lung volumes, it helps to increase your oxygenation. And people don't want to do it. Um, and then they end up intubated. And then a week or 2 or 3 weeks later, they're still intubated, and we end up coding them, and they're dying because we have done everything we can. And at the point where we've got you intubated, you're proning whether you know it or not, because we are sedating the crap out of you and we are paralyzing you with medications to try and prone you, or to actually prone you manually, to help expand your lungs and to decrease your oxygen demand. And it works. We see it work. We can take somebody that is laying on their back in a bed on a ventilator at 100% and flip them over, and within minutes of them flipping over, we're turning down their oxygen demand from 100% down to 80, which may not seem like a big deal, but that is a big deal. It really is when you're looking at COVID patients, because you can't go higher than 100%. You can always go back up to 100%, but you can't go higher. That's a joke we have with some of our respiratory therapists sometimes is, well, patients on 100% oxygen, can you go get us a tank of 110% oxygen? And they laugh at it because we know it's not possible. You can't oxygenate somebody more than 100% oxygen. It's just not physically possible. Um, and I know RTs have left the field. I know that doctors and nurses have left the field because the burnout is real. The um, watching people die on a daily basis is real. Um, and I don't get what some people don't get about that. It it baffles my mind to think that there are some people out there that still think of this as a hoax, still think of this as a conspiracy theory. And I know people like that. I know people in my real life that still think that way, and I've pretty much cut off communication with those people because I don't want to hear it. I don't want to hear your conspiracy theories. I don't want to hear your bullshit stories about how this is a government hoax and how this was just a ploy to get Trump out of office. Trump got himself out of office because he was a piss poor fucking president, um, who did a horrible job at handling this thing from the very beginning, among many other things. But I won't go down the political route, other than to say just that. I will say that um, a lot of us are still feeling the burnout. We're still feeling the want to just be done with this. And when we saw the waves come through, if you go back and you look at the data, the first three waves, I mean, they're typically about the same. We had a couple spikes here and there on certain days and things like that. But the first three waves that hit the United States were pretty much, the first two were about the same. The third one was a little bit lower. This fourth one has just blown all three of those out of the water. The hospital system I work in, I do know that we have over 1,100 cases just in our hospital system, which is multiple hospitals. It's not just one hospital. It's over a dozen hospitals, ranging anywhere from 120 bed hospitals to actually, I think our smallest is right about 100 beds, but from 100 beds up to 500 to 600 beds. I think our biggest hospitals are between 500 and 600 beds apiece. So when you start looking at the data of that and you start saying, okay, at our peak, at our highest peak during the second wave, we were sitting around 700 patients across the entire system. This wave, which we're not even through yet, we haven't even seen the peak yet because it still continues to go up here in Florida, here in the Tampa Bay area specifically. Um, we're climbing still. We're not seeing it go down yet. We haven't even reached a plateau, much less reached the top. I mean, if it was a plateau, it would be somewhat manageable. But that doesn't change the fact that people are still burnt out, that people are still tired of this, tired of the same thing. Providers and nurses and respiratory therapists and patient care technicians and everybody that goes into the care of one individual patient. Because it's not just a nurse, it's not just a doctor that's taking care of one patient. It's an entire team of people in the hospital. It's a team of multiple doctors. It's intensivists. It's a hospitalist who's the main doctor that sees you while you're in there. It's any other consults that you have. If you have any cardiac issues, it's a cardiologist. If you have any renal issues, it's a nephrologist. If you have any urology issues, it's a urologist. So it's all these different people coordinating the care of one person. Uh, and and even infectious disease doctors, they're very, very in on COVID because this is an infectious disease. It's right in their wheelhouse. So you have all these different people working together, and that doesn't even count the 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 person that's bringing you a meal tray, the food service rep that's just bringing the tray to the room, the chef that's downstairs preparing that meal, the uh, the person in triage in the ER that first saw somebody when they came in, the registration person that has to get that person registered into the hospital, um, where hospital ERs are seeing double, triple, quadruple, and quintuple their volumes in any given day than they were 2 years ago because of COVID. Everybody's coming in because they feel they have COVID or they want a COVID test or um, whatever else is going on. And that also puts a tax and a strain on somebody else that's coming in for another issue, somebody that's coming in with just a heart attack or somebody that's coming in for a stroke. If the ERs are backed up with all these other patients that are coming in with COVID, it can delay the care necessary for these people that are coming in with strokes and heart attacks and things like that. Um, Typically, those things aren't delayed. Typically, if you've ever been in an ER and you've been sitting there for 2 hours waiting to go back, and you see some guy get wheeled in on a stretcher, and you get mad because that person got to go back before you, there's a reason why they went back before you. Either they're having a heart attack or a stroke or some other life-threatening um, complication that warrants the fact that they need to go back to see a doctor before your sprained wrist or your broken finger or something like that. Um, your broken finger will be there in 30 minutes, an hour, 4 hours. That patient needs to survive if they're having a heart attack or they're having a stroke. Those things can't wait. That's why those people are taken back quickly. That's why those people are emergently seen. But with the volumes of people that ERs are seeing now, even those people are not getting the level of care that they deserve for the disease process that they're going through. They're not getting the urgency in some cases in some hospitals. Um, I will say specifically, I do know in my hospital, we still take those things seriously. We still, I mean, and this comes in coordinating all the way from the time a call is placed to 911 when EMS arrives and they call the hospital they're headed to. And they say, we're coming in with a patient we believe is having a stroke, or we're coming in with a patient that we believe is having a heart attack. And the staff before that patient even gets there goes into high gear to ready the room, to ready all the necessary supplies that they will need to deal with that emergency as soon as it gets there. And sometimes it's not a stroke. Sometimes somebody's just having some really bad acid indigestion, or sorry, not a heart attack. It's just chest pain, but they can't distinguish. It's hard. Some people have a hard time distinguishing between chest pain and gas pain or acid reflux because it's in the same exact area. And even doctors, they will look and they will say, okay, well, this doesn't point towards a heart attack. None of the labs, none of the tests we've done have pointed towards a heart attack. Then they start looking at other sources. They're like, okay, well, let's look at GI. Let's look at C. Is this just acid reflux? And then they'll go down that route. Because once they've ruled out the most critical thing they need to possibly take care of, then they will start looking at other options. Um, but when your hospital and your ER is full of COVID patients that have refused for months and months and months to get vaccinated for whatever the reasons may be, um, seeing that coming in when most of the providers, and I think the percentage, I want to say it's 95 or 98. I want to say it's 98% of all doctors are vaccinated. Um, and I will tell you that 98, I will tell you that 100% of all doctors are smarter than your Facebook friends that tell you that the vaccine is a government conspiracy to mind control you or to put a microchip in your body to be able to track your location. If the government wants to track your location, they're just going to search your cell phone. You carry that with you all the time. Nobody is without their cell phone anymore. So if you're worried about being tracked, get rid of your cell phone, and then you can't be tracked. There's no microchip in the vaccine. There is no mind control serum within the vaccine. Um, and people that are upset that the government is trying to mandate the vaccine, this has been done many times before. This has been done with polio. This has been done with many childhood illnesses that we have pretty much eradicated through the use of vaccines. Um, when's the last time you went over to your friend's house that had polio? Probably not ever, because polio has pretty much been eradicated in this country because of vaccinations. Um, Same thing with measles, mumps, rubella. MMR vaccine has been around for decades at this point, and we don't see cases of that in the hospitals like they used to years and years ago. And some of those things can cause severe neurological damage to children if they do get those types of infections. So that was one of the reasons that these things are these one of the reasons these things are mandated by school boards all across the country. Your children have to have updated vaccines to be able to go to school. There's a reason for that because scientifically we've proven that these things do work. Scientifically, we've proven that the COVID vaccine does work. There is tons and tons of data out there. And like I said, your friend on Facebook is not smarter than the epidemiologists who have been studying this thing since the beginning of this pandemic. Um, so, I mean, that's about all I have to say about that. Um, but one of the biggest things I can say is that um, people are tired. I have seen just the turnover in my small ICU. I've worked in this particular hospital for over 4 years. Um, and sorry, not over, coming up on 4 years here in a couple months. Um, but I can tell you right now that there are two people that have been there longer than me. Everybody else has left for one reason or another. Some of them left quite a while ago because they were the people, like I was saying earlier, that were working on their nurse practitioner, got their nurse practitioner, got a job, on to do something other than ICU. But a lot of people have been pushed out by COVID. A lot of people have gotten burnt out by COVID. A lot of people they don't want to come into work and slowly watch people die because that's what's happening. That's what we're seeing. Um, you hear the miracle cases about um, people with COVID. Uh, those are the few and far between. There are over 600,000 cases in this country where that wasn't the case. They weren't the miracle case. They were the people that died. They were the statistic. And some people say, well, it's only 1% of people that get COVID die. Um, that's not acceptable. That's still not acceptable. 1%. It sounds like a small number, but when you start looking at that number, when you start looking at the number of family members that are affected by that, um, it's sad. It's it's sad that people look at that and they say, "Oh, it's only 1%." 1% to some of those 1%, that's somebody's world. That's somebody's grandmother. That's somebody's mother, somebody's best friend, somebody's husband, somebody's wife. That's not just it's a person. It's not a statistic. It's not a number. It's a person that died. So to say that, and that's one of the arguments I've heard, well, it's only 1% of people die. Well, that's great, but it didn't have to be this way. It didn't have to be this way had this thing been handled correctly from the beginning. Had we had a better control on it at the beginning, um, we could have been down to 0.5% or 0.25%, or whatever that number would have been. Or maybe it was still 1%, but maybe that 1% wouldn't have been 600,000. Maybe that 1% would have been 6,000, and only 6,000 families would have been devastated by the loss of a loved one to COVID, rather than 600,000 families being devastated. And I mean, I can tell you stories of husbands and wives that we've had die in our ICU, days apart from each other. Um, that they both had COVID. Their family members gave it to them unknowingly to their parents, essentially, and they didn't make it out. They were part of that 1%. So that's all I've really got to say about that. If anybody has any questions, feel free to shoot a line in the text. I'll try and answer anything I can or anything that I'm able to. Um, Probably hang out here for a couple more minutes, see if anybody has anything. I appreciate everybody listening. I appreciate everybody that's come in to watch. I do appreciate the any replay viewers. I know that I have a couple people that do watch my broadcasts on replays. I appreciate you all. Thank you. And I am having an adult beverage tonight, so my biggest um, advice to everybody is still to wear a mask, vaccinate, wash your hands, socially distance. Um, it's not worth spreading this thing around to people unwillingly. Yes, cheers, Tori. Cheers. Uh, because like I said, I've watched people die slow and miserably from COVID, and it's not a fun thing to watch. It really isn't. It's not a quick, um, painless death. I'll just say that. It's not something that I would wish on my worst enemy. I wouldn't wish this on my ex-wife. As much as I despise her, I wouldn't want her to get it. Trump's already had it, and unfortunately, he had um, top medical treatment at one of the top hospitals in the country. Um, I'm going to reserve what I really want to say about Trump and him having had the virus, um, for fear of getting banned from HAPS if they watch this. Or Twitch or YouTube, where I also broadcast these, and Twitter. If anybody doesn't follow me on Twitter and they do follow me here, same hash or same it's at BCMerce on Twitter. I have not been as active on there as I have in the past, but I've been becoming a little bit more active and posting a few more things recently. I do follow some good people, trying to repost some of their stuff, try and post out accurate information, credible news sources, and things like that that I feel are appropriate. Um, and then sometimes I just post some stuff that's funny because sometimes you have to laugh. You have to be able to laugh sometimes just to be able to get through the day. It makes laugh. They say what laughter is the best medicine, right? So sometimes we all need to laugh. Sometimes we all need to just take a minute and look at the funny things in life and appreciate those things because sometimes we don't know when those things are going to be taken away from us. So, like I said, I do appreciate everybody that came in, listened. I see it looks like there's about 7 people in the chat here, or 7 people viewing, as far as I can tell. I don't know how that works actually. I don't know if that's a user count just from Haps. I don't know if that. I don't think that goes across. I don't think Haps viewer count goes across platforms. I don't know if it will show me who's watching on other platforms or not. Um, Something I should have probably ask Haps. But I used to be on Periscope. For anybody that hasn't ever seen me before, I used to broadcast on there, talk about COVID quite a bit back in the beginning, talk about the numbers, the cases, some of the treatment options that were available. Currently, some of the treatment options that are still available, just so people are aware, we're not really using convalescent plasma anymore for Delta variant because it does not show to be as effective. We are still using remdesivir. We are still using Actemra or tocilizumab, which is a um, immune modulator, which does show to help prevent the no, I'm drawing a blank. I'm trying to think of what it prevents. It prevents um, cytokine storm. It helps to prevent cytokine storm in people with severe COVID. Um, and in clinical trials, it shows to work very well. And the combination of these meds um, seems to, and especially Actemra, which is the tocilizumab medication, is shown to reduce hospital stays significantly in people that are admitted to the ICU. Anywhere from somebody that might stay 34 days or so, 32 days, is down to 18 days in the hospital. So this medication is showing promise for a lot of people. Regeneron is another one that they are giving out now. That's typically a one-time dose. They're giving that to people that are coming into ERs that aren't specifically very sick, not requiring hospitalization and high levels of oxygen, but they are requiring certain levels of medications to help them because they are at a threshold where they find that the Regeneron seems to help prevent them from possibly getting in the hospital. And that medication does seem to be helping people as well that are coming into the hospital. Like I said, not as severely sick, not requiring hospitalization, not requiring constant monitoring, but you can just go home and work through this. And not everybody does. Not everybody does work through this. We do have people that do have to come back. But the I've lost my train of thought. Sorry. Oh, the Regeneron. Yeah, it does show promise with people that have low viral loads and low or not low, but not as severe cases of COVID. And then there are a couple of other meds. They're still in trials. Trying to think of the one that we did. We did a trial on my specific hospital. Um, I can't even remember the name of it now. I can see the binder, but I can't remember the name of the med. But yes, there are multiple drugs that are still being tested at facilities across the country for treatment of COVID. There are research facilities research hospitals that this is what they focus on. This is what they might be running multiple studies based on different drugs that are out or different combination of drugs that are out that they're trying to use to figure out, okay, if we use this drug alone or if we use this drug in conjunction with this drug and with this treatment and with this frequency and this dosage, does this work better than what we were using before? So, I mean, it's consistently being updated and tested and theorized and put through the ringer by epidemiologists and doctors to make sure that what we're doing at the current time is the best practice for anybody that is coming in with COVID, for anybody that has contracted this horrible disease. But since I really don't have any questions, I guess that I'm probably going to get going. I appreciate everybody listening. I appreciate any replay viewers that made it this far into the discussion, just listening to me rant and rave, and just kind of talk off the cuff about different things. But yeah, I did want to bring up the fact that there are a lot of people that are burned out, a lot of providers, a lot of healthcare people, doctors, nurses, therapists, or respiratory therapists, and even other staff. It's taxing. It's stressful knowing that, well, if I go into X amount of COVID rooms in a day and maybe the seal on my mask is not what it once was, am I going to take this home? Am I going to give it to my children, my spouse, my husband, my wife, my elderly parent that might live with me? There's all that stress that goes along with this. That people just don't think about, but that as a nurse, I do think about. As a nurse, when I walk into a room, I mean, those things they're not in the forefront of my mind, but they are in the back of my mind. They are things that I do question, that I do think about. Did I have a good seal on my mask? Was the patient coughing? Were they doing this? Were they doing that? Had to go into the room because their vent got disconnected inadvertently, or it was alarming for some reason. I had to go in there and change something out and break the vent circuit, which aerosolizes the virus itself. Am I going to take this home to my kids? Am I going to take this home to my wife? To anybody else that I might end up being around over the next couple of days? Those things are always weighing in the backs of our minds as nurses, doctors, healthcare providers in the hospital setting. It's not something you can shake. It's not something that, oh, it'll be fine, because it won't be fine. Because if I were to bring this home to one of my children and they were to get sick and die of this, that would break my heart. That would be absolutely devastating. But yeah, so wear a mask, get vaccinated, wash your hands, socially distance. Those are my 4 biggest pieces of advice to everybody. I hope you all have a good night. I appreciate everybody that stayed and listened to me just kind of rant and rave tonight. I appreciate anybody that, like I said this before already, any replay viewers that might catch this later. I hope you all have a good night and take care. I'm going to get out of here.